In phase 2 of your rotator cuff protocol, the sling is now coming off and we are looking to move the arm actively and passively, trying to restore all the movement that was lost in the immobilization phase or the sling phase of the rotator cuff protocol. Remember, your immobilization phase or your sling phase is phase 1, 0 to 6 weeks. Phase 2 is your active range of motion phase. That's weeks 6 through 12, where we're trying to restore all the stiffness and tightness that kind of developed from wearing that sling in the first 6 weeks. Okay, welcome back. We are now in phase 2 of your rotator cuff protocol. The sling is now off and we are actively moving the arm with some active assisted movements and some kind of quasi-passive range of motion movements. So we're dealing with a right shoulder rotator cuff repair. We're going to have the left arm help the right arm by using some sort of stick device. You can use a golf club, a broomstick. This is some PVC with a 90-degree elbow. So on the rotator cuff side, we're going to put the right thumb up. We're going to put the left hand shoulder width apart. Okay, we're going to use the left hand to push up to the ceiling, and then push the right one up. You're going to come all the way up perpendicular to your body with the elbow straight. This is the beginning or start of the movement. Notice the pillow she's on. We're going to pull it back and get it away from her shoulders so her shoulders can clear. Okay, Kendra, you're going to go over your head and just stretch your arm to your tolerance. When you feel a light stretch, you're going to hold it there 3 to 5 seconds and come back to the center spot. 1. We're going to do that 3 to 5 times. We're going to go over your head. We're going to hold it to your comfort level. 3 to 5 seconds. Come back to the center. We're going to do that one more time. Over your head. Good. This is our famous cane exercise in the shoulder flexion. Now we're going to spread the hands out wide, get a slightly different angle on the shoulder. Notice the thumb is still up. And we're going to go back over your head again to your tolerance. Good. 3 to 5 second holds. 3 to 5 reps back to the starting position. 1, 2, good. One more time. 3, good. Back to the center position. Bring your left hand in closer again. Good. Now your left hand is going to help guide your right arm back down. And we're going to go back to the starting position. Good. And relax. Our phase 2 rotator cuff repair exercises. We are now in left sideline for a right shoulder rotator cuff repair, and we're going to do external rotation against gravity. So relaxing the arm, elbows by your side. We're at 90 degrees. Make a fist. We're going to let the fist roll down and then bring the fist up in the air. 1, and repeat 10 times. 2, 3, good. Notice her chest is up tall, shoulder blades back. Her elbow is in alignment here. You only go to your tolerance. If it hurts to move your arm in a big movement, keep it small and easy. Good. And we'll call that 10. Lastly, we're in phase 2 of a rotator cuff repair. We have Kendra laying on her stomach, relaxed. Her right arm's hanging off the side of her bed. Her body is on the bed, so she doesn't feel like she's rolling off. She's really angled on the bed. And the exercise is going to be to take her right arm and try and pull it back to her hip. Good. We don't go higher than the hip. We go down halfway and then right back up. And we're going to do that 5 to 10 times. 2, 3, 2 more. This exercise generally feels really good to people. 4, 5, and relax. As you relax, let the arm hang down with gravity. Good, and relax. In that relaxed position, you can pump your hand a few times if you'd like. And you can also do some gentle pendulum circles if you want, 5 or 10 times clockwise, and then you can go 5 or 10 times counterclockwise. As we first get started, we do 1 to 2 sets, and over time you can do 2 to 3 sets and then also increase your reps. So we'll go one more time, Kendra, keeping the thumb in the thumb up position relative to your face. Good, down. 1, and again. 2, we're always chest up tall, shoulder blades back. 3, 2 more. 4, last one. 5. Good, and at the end we relax the arm. Like always with all of these exercises, we want them pain-free and comfortable.